It's the end of the weekend, but there has been no break from the COVID crisis. And most concerning right now, the number of people checking into hospitals. The OHA started posting updated information on its website showing the state's COVID patient numbers. As of today, there are 546 patients fighting the virus in hospitals in Oregon. 113 of those people are in the ICU, 5 fewer than yesterday, but generally that number has been on the rise. And it's a tough situation, not only for families, but also for caregivers on the front lines of this pandemic.
Yeah, Fox 12's KANDRA Kent spoke to one of those workers who has a message she wants all of us to hear tonight. KANDRA?
Yeah, that's right. And as we are in the very thick of a really tough few weeks here in the pandemic, I did speak with this nurse who shared just how emotionally and physically exhausting her job has been, not just over the last couple of weeks, but really since this last spring. Now she's really hoping that as we approach winter, we can buckle down again to better social distance with her patients and her coworkers in mind. In a year like no other, there's nothing that compares to the work of those on the very front of the front line.
We are exhausted.
OHSU nurse Grace Bradley calls it a marathon, this pandemic that's pushing healthcare workers to the very brink, especially as Oregon hospitals struggle to staff shifts and bring in the traveling nurses sought after nationwide.
We're trying our best to kind of come together and work together as a team to fill in the gaps and work extra shifts, and we're doing that, and we'll continue to do that.
If it's been a marathon since March, it's still nothing short of a daily sprint to try and save the very sickest of OHSU's COVID-19 patients.
I'll leave these shifts so dehydrated, just because you get so in the zone and you're taking care of this sick patient and you're doing the work of 3 or 4 people if you can, because you're putting their needs above your own.
Bradley is specially trained to care for patients too sick for ventilators and said they're hooked up to machines that act like external lungs, something called extracorporeal life support. Many of Bradley's patients die all alone, their goodbyes reduced to video chats.
I'll never forget, seeing the faces of these family members who were seeing their loved one for the first time in weeks. And when they saw him, he had this big tube coming out of his neck. I don't have the words to describe the heartbreak of that situation and seeing that.
Emotionally devastating, physically exhausting, and public health experts warn the darkest days of the pandemic are still to come.
I'm terrified, I'm super scared. It is really hard because I do love this work so much, and but it takes a lot out of it.
As a lifelong Oregonian, Bradley says she was never prouder than this spring when the state came together to stay home, reduce the spread, and keep hospitals accessible. It's that kind of support she'd like to see again this winter that could be a boost toward finally a finish line.
We really need that buy-in. As a collective, we need to do that together.
And Bradley also wanted to express her gratitude for her family, her co-workers, hospital administrators, and managers for making her job and her life a little bit easier during this really difficult time. She also wanted to clear up what she calls a misconception. She says not all of her patients are elderly or medically fragile. In fact, she says all of her patients on life support right now are under the age of 70 years old, and she says most of them are under 60. Reporting live tonight in North Portland, KANDRA Kent, Fox 12 Oregon.